Today's country and your all-time favorites, 95.1 The Bull. Rob Getz in the bullpen, and joining me here for our community conversation, got two guests joining us here for this week. I have Lisa Welter from Chickasaw County Public Health and Dr. Lucas Brinkman here joining us this morning. Guys, thanks a lot for joining me.
Thanks for having us.
Yes, thank you.
Absolutely. Well, Lisa, of course, we last spoke around last month and talked about a couple different topics at hand. And as we are in the month of March here, a couple of different things we want to discuss. And Lisa, go ahead and tell us what one of the things we're focused on for.
Yes, one of the things is there are several HIV and AIDS awareness days throughout the year. HIV is a virus that attacks the body and the immune system. Currently, there's no cure for HIV, so that's why it's really important to stay in control and seek proper medical care for HIV. Mm-hmm. HIV has several stages. The first stage being an active stage, so you can have like flu-like symptoms in that stage. The second stage then that it progresses to is kind of a chronic stage, and at this stage, you might not have any symptoms. But if not taken care of, again, it progresses to the last and final stage, stage 3, which we know as AIDS. And this can, have bad damage on the immune system and things, and doesn't end well. So that's why it's really important to identify this early and take care of it.
And of course, the ways to prevent against HIV and AIDS and other STDs and STIs as well. What are some of those options there?
Yeah, so the ways it can be transmitted would be sexual contact, sharing needles, and it actually can be passed on during pregnancy, birth, and breastfeeding. So some of the things that we want to do is not share needles, use protection when having sex, and just be mindful during pregnancy and things like that if you have it, to take preventative measures. Also want to throw in there, it's not transmitted by water, saliva, sweat, tears, insects or pets, sharing toilets, food, or drinks.
Yep, it basically just the bodily fluids through these transmissions from there.
That is correct.
Yes. Lisa Welter joining us here this morning, here on the Morning Roundup, 95.1 The Bull, and of course online at 951thebull.com, where you will see this community conversation right here. So what's another topic we're focused on here?
Well, March is also Colorectal Cancer Awareness Month. Each year, over 50,000 people die from colorectal cancer in the United States. It's the third leading cause of cancer in men and women. However, this doesn't have to be the case. There is effective screening for colorectal cancer. The U.S. Preventive Health Services Task Force recommends adults 45 to 75 be screened for colorectal cancer. The task force also recommends adults age 76 to 85 talk to their doctor about screening. 85 and up, colon cancer screening is no longer recommended. In May of 2021, the screening actually went from 50 to age 45 due to the large amount of younger people that are starting to get this disease. There's two major ways that we can screen for colorectal cancer. One is a Cologuard. You might know this from the box from TV. Basically, your doctor prescribes the box and the company mails it to you. You collect the sample, mail it back to the company. Your doctor gets the results. If it's negative, you're good for 3 years. If it's positive, then it's time to go ahead and schedule a colonoscopy. A lot of that being said, there are some false positives and negatives. 13% of the patients with colorectal cancer advanced adenomas receive a false positive test, and 8% receive a false negative test. Those are still really good numbers, and it's a very good test for those that are reluctant to a colonoscopy. The gold standard still remains, however, a colonoscopy, which involves a prep of the colon, sedation, and examination of the colon using a camera. It is up to 94% accuracy rate. If you have a negative colonoscopy, your screening is good for 10 years. If you have polyps or other types of issues, then the recommendations go based on the pathology from those. With anything, the colonoscopy has complication rates of 9% bleeding, 3% perforation, which are still very low compared to other methods. So
that's all things good to know coming from Dr. Lucas Brinkman here, joining us this morning here on the Morning Roundup. And thank you for that insight on that, Doctor. Appreciate it.
Yeah, I just think it's really important. I think as far as cancers are concerned, colorectal cancer is the one I think that we can prevent the best. We have wonderful screening tools. It just takes you getting out to your doctor and having that discussion.
Very good. Dr. Lucas Brinkman joining us along with Lisa Welter here for on behalf of Chickasaw County Public Health on 95.1 The Bull. Lisa, what else we have for the month of March here?
So we're going to talk about nutrition. We've put together some different programs that are offered in Chickasaw County that people might be interested in. So one, a lot of people have heard of this, the Meals on Wheels. That's through the Northeast Iowa Area Agency on Aging. So if you're interested in that, they do a congregate meal at the event center here in New Hampton, and they also do at-home meals that they deliver. So if anybody is interested in more information on the Meals on Wheels program, they can call the Chickasaw Event Center at 394-3173. And they said to ask for Morgan, and Morgan can give you more information on that. There are several food pantries that are located in Chickasaw County, some of them being New Hampton, Nashua, and Fredericksburg. And there is one here that a lot of people don't know about at the high school here in New Hampton, and that is open 24 hours a day. So that anybody can go at any time and go get items from that.
If I'm not mistaken, that food pantry is right inside the breezeway at the main entrance there. If you go to your left, you will see the food pantry over there.
Yes, I believe you're right. So there's different, not just food, but I believe there's other, items there like soap and shampoo and things like that.
All the essentials needed for the household there, definitely. Lisa Welter joining us this morning along with Dr. Brinkman here on 95.1 The Bull. I see we've got a few more items that we'd like to talk about here. Let's go ahead and talk about the next item.
Yes, that is correct. So we have a couple different meal options that you can order these foods and they're delivered to your home. So one is Mom's Meals, and they're out of Ankeny, Iowa. So what happens there is I believe some of them possibly are covered by Medicare, like Advantage plans and Medicaid plans. They deliver these meals, these packaged meals to your home, and they can be refrigerated for up to 14 days. So if you're interested in the Mom's Meals, that number is 877-508-6667. And then another option out of Humboldt, Iowa is Sister Meals. And there's 20 different meals, and you can choose which meal you would like. They do change those meals every 3 months. Meals are prepared in their own kitchen. They're proportioned and froze, and then they arrive at your house by FedEx. So if you're interested in that one, that number is 515-332-1928. And then kind of the last option I have for food in Chickasaw County is the SNAP program. A lot of people have probably heard of that one. That is through the Health and Human Services here in Iowa. It's kind of a nutrition program that helps people who are low-income households purchase nutritious foods for themselves. So that number is 855-944-3663. And if you call that number, they can help you out and get your information and see if you qualify. And they do everything by the phone and get all that lined up.
Excellent. Lisa, thanks a lot for that information here on 95.1 The Bull. And I believe there's one more that we'd like to talk about. And this is one that we've been getting a lot of questions and concerns, is the ongoing information about the avian influenza, also known as bird flu. Could you elaborate on that?
Yes. So on Tuesday, I was notified that we had our first case of highly pathogenic avian influenza, or more highly known as bird flu, here in Chickasaw County. It was identified in a backyard flock. So the Iowa Veterinary Lab is continuing to see where it originated from. But at this time, they presume that it actually was, it originated in a wild bird. Usually in 85% of the cases, wild birds are the cause of that. So wild birds can carry the avian influenza virus, and they don't get sick from it. But when they pass it on to domestic birds, such as like chickens and turkeys and things like that, they can get sick and die from that. So the virus can be spread through droppings or nasal discharge of the infected bird. Individuals from the Iowa veterinary lab in this specific case were on site, and they followed their protocol and helped prevent the spread off of that backyard flock. So this case at this time does not present a public health concern at all. It was isolated and taken care of, at the location of this backyard flock. So public health has contacted and will continue to monitor the individuals who have been exposed to this particular backyard flock, just to make sure that that hasn't spread at all. It's kind of protocol to follow them for 10 days and check in with them every day. So it is actually important for you to get your flu vaccine every year. This doesn't prevent the infection of the bird flu passing on to humans, but the risk of getting sick with the human flu or the bird flu is actually reduced. Some signs to watch for if you do have backyard flocks are sudden bird death, decrease in your egg production, if your eggs start to get soft or thin, some swelling of body parts of your flock like eyelids, they might stumble or fall, they might have diarrhea, coughing, or gasping for air. So if you see any of this or anything out of the ordinary, it's really important for you to contact your veterinarian.
Excellent. And of course, further information on that, how can we get in touch with you and learn more about that?
That is correct. We'll be putting some information online and just kind of keeping everybody updated on that. If anybody does have any questions, I can take questions at the office.
And of course, more information to get in touch with you. How can we contact you?
You can give us a call at 641-394-4053.
Excellent. Well, Lisa Welter joining us along with Dr. Lucas Brinkman. I thank you guys both for coming in today, speaking on many various topics for this month here for the Chickasaw County Public Health and for the county, Chickasaw County. Thank you guys. I appreciate it.
Thank you.
Thank you again.